Diagnosed with heart disease, now aware of things to avoid consuming, but the list is extensive. When you go online, all sorts of things come up. This video will be enough for you. I will talk about 8 things that heart disease should stay away from. Margarines are now the top of the list of things heart disease should avoid and no longer be included in the diet. Although margarines seem to contain no trans fats when you look at the packaging, they actually contain trans fats. Margarines are trans fat deposits and grotesque fats. Margarines are processed fat products. Already the raw materials of these are refined oils like sunflower oil, palm oil, and when a reaction like hydrogen saturation is added on top of these, they exist in solid form in room air and also in our bodies. This is what we call trans fat. Trans fats are fats that cannot be melted, burned, or processed by normal enzyme reactions at normal body temperature. These substances accumulate in our veins and organs. Margarines are directly linked to cardiovascular diseases. Sugar is second on our list. A heart patient must avoid consuming sugar for the rest of their life. The World Health Organization considers 40 grams of sugar acceptable for men and 35 grams for women during the day. But this includes fruit as well. If you remember our fruit video, we already get 10-15 grams of sugar from fruit during the day. When we add the bread consumption during the day, we actually already consume a significant amount of sugar indirectly. So now there is no need to especially include sugar in our lives. On the contrary, there is a need to remove sugar from our lives. Sugar consumption is usually the main cause of diabetes globally. We typically do not welcome the question of whether I can eat sweets, sir, for heart patients. Maybe there could be a milk-based dessert as long as it doesn't exceed once a week. But sir, even if I eat 2 slices of baklava every day after meals, I can't have a bowl of rice pudding. A person with heart disease should eliminate sugar from their life. 3. Bread is next. Bread is crucial in Turkish customs. It, particularly white bread, contributes to insulin resistance, heart diseases, diabetes, and hypertension. One of the most common causes of Alzheimer's. As Turkish society, we consume a lot of bread. We love bread. Bread is our trouble. I can even say as dangerous as sugar. Bread is a food that can turn into sugar even in our mouths and exhaust our bodies, raise our insulin levels, cause blood sugar fluctuations, and trigger oxidation mechanisms in our bodies with continuous consumption. If you frequently consume bread, the key is to avoid transforming bread from white to black, from white to black wheat, but rather to generally limit bread consumption. Limit bread. 4. Processed meats coming. They cause diabetes and heart diseases globally, being a major health concern worldwide. These are not real meat. In fact, processed meats today are now classified as what we call ultra-processed meats. Processed meats are a main cause of heart disease and diabetes. Consuming just 40 grams of processed meat daily, like salami and sausages, has led to a 42% rise in diabetes cases globally. Children who consume only 1 hot dog a week increase their risk of leukemia by 11 times. Processed meats are this dangerous. Schnitzel, nuggets, salami sausages should be removed from our diet. You are able to consume fermented sausages, but you should keep a distance from other processed meats. Fried foods are in 5th place. Regardless of what is being fried, trans fat is generally formed during frying. Usually acrylamide is formed. Frying is a very fast cooking process and it causes asparagine amino acid to turn into acrylamide substance, which paves the way for cardiovascular diseases. What causes the formation of trans fats? We generally recommend avoiding fried foods in cardiovascular diseases and preferring cooked meals in pots. The food cooked in a pot, boiled food, and thrown food are always better than fried food. 6th on our list. Next, packaged foods are coming. Not all packaged foods are banned. For heart patients with angioplasty, blocked veins, heart failure, bypass, or stent, the risk is high. Now it's time to remove packaged foods from our lives in general, because if a product is packaged and the number of active ingredients in it increases, it means that the risk also increases. Translate packaged foods, you'll often find margarine palmia, processed salt products, monosodium glutamates, sweeteners and enhancers on the back. These are seriously harmful to our veins. If you have a heart condition, I recommend switching from packaged foods to home-cooked meals in general. 7th on our list. Next is grapefruit. I know you're surprised, banning it for this reason. Grapefruit has a serious interaction with medications used in heart diseases. In particular, patients who are using blood thinners may experience an increase or decrease in the effect of the blood thinner due to its interaction with the underlying mechanism of the medication. Grapefruit is a very healthy fruit. It is one of the fruits we recommend the most. But if you have a heart condition, if you are taking medication for heart disease, grapefruit consumption can interact with these medications. In fact, although grapefruit is harmless, it can pose a problem for individuals who are on medication. And finally, our list's 80th. I especially want to open a parenthesis during there is something that should not be consumed in patients using blood thinners by blocking only vitamin K and thinning the blood. These are green leafy vegetables. Green leafy vegetables are the basis of the Mediterranean diet. Green leafy vegetables are one of the best sources of nitric oxide and anthocyanins, which meet our fiber needs the most. Greenery is already a must for a Mediterranean diet, but if you are using a cancer inhibitor that blocks the effect of vitamin K, its name is warfarin, varfamadin, coumadin. If you are utilizing one of these, green leafy vegetables are prohibited for you. Why? Due to the fact that these green leafy vegetables contain a significant amount of vitamin K, if you are utilizing a blood thinner that blocks vitamin K by inhibiting its function, you have the potential to alter the effectiveness of this blood thinner by consuming vitamin K from green leafy vegetables. Green leafy vegetables are actually highly beneficial for health. Certain patients who utilize blood thinners can pose a challenge for us. Patients usually recognize themselves. They know to avoid greens. Sir, let me consume greens. I'll adjust blood thinner dosage accordingly. No, it's not possible. You cannot know how many days your body will produce farting factor again after taking a vitamin K. Therefore, the healthiest option is to avoid green leafy vegetables if you are using this type of blood thinner. The first 6 items indicate the foods to be avoided absolutely, while the last 2 items indicate the foods we recommend avoiding due to the lack of drug interaction in patients who use more medication. If you have a heart condition, avoid the foods in the first 6 items. Don't forget to subscribe and enable notifications. Goodbye.